emergency physician lead for Northam Health Service, but I'm also the Director of Clinical Training here. I'm mostly based at Northam, but I do sort of travel around Wheatbelt, delivering education and connecting with clinicians and bringing them all together.
I'm the current resident medical officer here at Narrogin Hospital, and I've been here for the last 8 weeks.
I'm one of the ED RMOs here at Narrogin. I usually work at Fiona Stanley, but I'm just here as part of the Community Residency Program. Community Residency Program is a program that is aiming to encourage junior doctors to try and consider working in rural areas in the future.
I deliver the education for the junior medical officers. Northam Health Service and Wheatbelt Health, in fact, have been very passionate about growing our own, and you know, we've had a well-established RCS, and in the last few years we've grown the junior medical officer cohort. 2019 there was 1 junior medical officer based in Narrogin. We've now got 8 across the region.
So a typical day is I get here at 8, and then we start with the ward round in the morning, which is normally intersected with a meeting at 9. And then after that, it's kind of just been cracking on jobs. So doing things like reviewing bloods and results, calling specialties up in the city, any specific reviews patients need.
I'm usually working in the ED department, but one day a week I'm also in the GP clinic here, so you get quite a broad range of experience. Seeing patients stabilise before they go to Perth, and then also get to see the chronic health management side in GP as well. A lot of, especially farmers, which is quite a decent amount of our population in ED, often wait till very, very late to present to emergencies. So often you're trying to tie up quite a multitude of different problems. So from a medical perspective, it's really good in terms of getting used to managing quite a lot of pathology in one patient.
Certainly since we've had JMOs, the feedback has been consistently extremely positive, and they're all very pleasantly surprised about how much they've learned and how much they've enjoyed and how much they've understood the issues around health access and the challenges, but also the joys of healthcare and working in healthcare in rural communities.
I do usually 8 to 4, Monday to Friday, but you also have opportunities where you can choose to work out in weekends, and you can also start to help out with C-sections if you're interested. Other staff here are quite happy to have you even helping out theatres if you're interested in surgery.
We've got medical education officers who go above and beyond to ensure that the JMO experience is a really positive one, that they have good quality accommodation, it's multidisciplinary and multi-format education, it's quarantined and paid.
There's always at least a senior around, and sometimes we also have a nurse practitioner around as well, so it is very well supported. And we also have the telehealth service, which we can also call in as well as to get further advice. If you want to especially gain independence, I think sometimes that's an issue in the city hospitals. To be honest, sometimes you can feel like you're just doing a lot more admin rather than focusing on the medical side. So that's a real highlight for doctors if they come here to actually get your hands stuck into doing some medicine. If you're considering rural GP, hey, this is a great way to actually get some experience before deciding whether you do the rural GP pathway and commit to that later on.
I'd say give it a shot, especially if it's something that they're not entirely sure what path they want to take down, or they just want to experience something new. I would wholeheartedly suggest coming down here and experience working in a rural place.